action. So today I want to talk about the dreaded cystoscopy. Oh my gosh. When it was first mentioned that you will feel like you are peeing out razors. Oh my gosh. I have experienced that and it was absolutely terrifying, dreadful. I'm like, well, at least it was said, so I guess I'm on the right road to recovery to have to endure this. And I hope it was worth it. And then once I get this diagnosis that I need, that my life will be so much smoother when it comes to my bladder. But that was not the case. That was not the case at all. I got my diagnosis of interstitial cystitis with overlapping overactive bladder. I remember shortly after getting the diagnosis, I was put on amitriptyline. And I thought, okay, well, this is definitely helping that I'm not getting up at night with the urgency frequency. I was able to get a good night's rest, although I would wake up a little groggy until it started to take effect for my body to adjust to it. And then I did start to experience some weight gain. So how do you weigh out the pros, cons? Should I continue to stay on this medicine? So that's what me and my doctor had to then move forward and figure out. Okay, by that time, some time had passed. I wound up having to go to a different doctor. And the first thing out of his mouth was, well, got to get you set up for this surgical procedure to have a cystoscopy. And I'm thinking, I have my medical records. Here is my diagnosis. I see overactive bladder. Babe, can you turn that off? So I'm thinking, I have my medical records, the IC, the overactive bladder, and this was done not long ago. Do I still really need to get another cystoscopy considering what I went through with that cystoscopy? And it was nothing fun. I'm like, I had to go home, and I felt like when I was voiding, the way it was described, razors, razors, razors. It just felt like cuts. I was just voiding out. So he said, well, yeah, with you being a new patient, I'd like to have my own medical records. Now, the record was no more than, I don't think, 2 years old. So I said, okay, well, if it's okay, I'll consider it, and then maybe we can go from there. Now, by this time, social media wasn't popping as much. It wasn't as useful to go in the groups. Hey, what is your take on your cystoscopy, or how did that go for you? Just to get that personal experience. So I did wind up getting another cystoscopy only because I was having bladder Botox done. So in total, I've had a total of 3 cystoscopies and 1 hydrodistention, along with some installations. The only reason why I bring up installations is because when I was having a catheter inserted into my urethra, I did experience the pain of feeling like I'm voiding out something that was having a cutting effect. Pyridium that was prescribed as a numbing agent, like when you void, for it to be a numbing effect in your bladder, but it did not help me at all. But guys, ACC2. I'm at a point now where I feel no more hydrodistensions for me. No more. I'm done with them. Now, if anything changes with my symptoms, okay. Me discussing with my doctor to think that he or she would recommend that, then yeah, I would do it. But considering time after time I would get them done and no doctor could really explain to me as to what would be the beneficial factor for me getting a cystoscopy that often, I decided for me personally, and I told my doctor, I don't feel that I would benefit from it because you're not really giving me anything concrete to work with for me to feel confident in doing so. I feel that me and my doctor, we have really good open communication. So he was okay with that. I was okay with that. We were comfortable with that. He gave me information on things to be aware of if anything should change versus what I'm currently experiencing that has been consistent with the urgency, the frequency. He's asked me about any pain that I have noticed. Any blood that I've noticed in the toilet, which I have not. He's taken microscopic tests, no blood. So he was just telling me what to be on the lookout for if anything does changes with my symptoms. I still go to a urologist or a urogynecologist to check in, to keep a record of how I am doing. I don't go as often as I used to. Before, I used to go every 3 months or every 6 months. Now I go at least once a year. And if I need anything, it's nothing for me to reach out on the portal for them to assist me or see me. But the idea of that hydrodistention, it still stands out in my mind, or even just getting an installation. Because sometimes I would find that to have a burning effect as well. So I asked the nurse one time, what is up with the cleansing agent? Because I think I am experiencing an allergic reaction from the betadine, the cleansing agent that is being used. Is there anything else that can possibly be used so I can find out if I might do better on something else? So after the nurse talked to the doctor about it and my concerns, the doctor came on in to visit with me and said that they would be willing to let me try another form of a cleansing agent in case that could be the culprit of the burning of me voiding after the procedure cleansing agent has been applied. And when I tell you, I was so much better when the procedure was done, having the installation done with the catheter, because you still have to go through the process of having the urethra sanitized, cleansed for the insertion of the instrument that is going to be used. Although a catheter is one thing and the looks of the instrument for the cystoscope is another. But because of a tool instrument is being inserted into the urethra, UTI, any form of any type of bacteria to not be introduced, they have to take every precautionary measure that the area is cleaned. Clean, sanitize, so no cross-contamination if that can be avoided. So I'm just going to tell y'all straight up. I mean, that's a decision me and my doctor made together. I would say definitely make your decision with your doctor for what is best for you. I wouldn't encourage anyone to just decide all by yourself, without any medical guidance involved, to get with your doctor and just tell your doctor how you're feeling. And hopefully no, your doctor has good professional bedside manners. Hopefully your doctor has a supporting ear to hear, because not all doctors are the same. Some just want to get you in, get you out, keep doing things by the book as routine and not think, okay, wait a minute, it's good to do things by the book, but sometimes I feel like a doctor has to think outside the box. Like, I can't just treat this patient like a one size fits all. I got to think a little bit more to personalize their treatment plan. So thankfully that has been taken into consideration, because I have met some good doctors along the way, but it's been a lot of trial and error. But most of all, always be your advocate. Always speak up. You know your body best, and be able to communicate those words effectively to your doctor in hopes of you getting some relief. Because some people can get a hydrodistention every 3 months, every 6 months, and they feel great. They said it's something about the nerve endings being disturbed, broken up, healing, and the pain has dissipated. I think that's great. That's why too, I feel like if something is for you, I'm glad I did do the cystoscopy in the beginning that I didn't know a lot, because a lot of times if we're not careful, we'll have different ones in these groups making up our minds for us, when maybe in fact that was the treatment that maybe we should have done, that maybe would have worked. So think for yourself, get with the doctor, have a supportive team that is open to support you. And then what you do say, you have to be leery of people that's always knocking something down that you're saying that could possibly help you, just because they may have had a bad situation with it. But as for me, as of right now, no more cystoscopies. If anything should change up and the doctor is really pushing for it, then yeah, I would do it. But it's been a few years now since my last one. A few years. It's probably been over 5 years since my last one. And my doctor is okay with that. So just wanted to share that cystoscopy talk. Until next time.